Hello, my name is Lamika Jackson. This is Sylvia Salas, Keena Jackson, and Andrea Jackson. Uh, we are from Mississippi University for Women, RN, BSN program. Today we will be presenting a PowerPoint on HIV and AIDS. And right now I will be presenting the objectives. Objectives. The learner will be able to identify the group at high risk for HIV and AIDS. The learner will understand the pathophysiology of HIV/AIDS disease with 85% accuracy. The learner will be able to recognize signs and symptoms of HIV/AIDS disease. The learner will be able to recall three of the five areas of clinical management. The learner will be able to list one effect of HIV and AIDS disease on the individual, family, and society. The learner will be able to discuss two of the five problems listed in the plan of care. What is HIV and AIDS? HIV stands for Human Immunodeficiency Virus. It is the virus that can lead to acquired immunodeficiency syndrome, or AIDS. Unlike some other viruses, the human body cannot get rid of HIV. That means that once you have HIV, you have it for life. AIDS stands for Acquired Immune Deficiency Syndrome. It is related to HIV, but they are not the same. A person has AIDS only in the final stages of HIV. After the immune system becomes unable to defend itself against foreign invaders like bacteria, viruses, allows the development of certain cancers. The history of HIV and AIDS. The world first became aware of AIDS in the early 1980s. A growing number of gay men in New York and California were developing types of pneumonia, cancer, and a wasting disease was spreading in Uganda. Doctors reported AIDS symptoms under different names such as gay-related immune deficiency and also SLIM. By 1985, AIDS were reported all over the world. HIV-1, most common strand of the virus, was transmitted by humans from chimpanzees sometimes in the early to mid 20th century. Researchers aren't sure exactly when and how HIV developed. And in 1985, the first blood test for HIV was approved. And then in 1986, the drug AZT, a failed cancer drug, was tested as an HIV treatment for the first time. Okay, in the 90s, AZT was the only drug treatment for AIDS, and then in 1996, doctors started to prescribe a combination of medication, including new protease inhibitors to control HIV. And then in 2006, the number of AIDS-related deaths and new HIV infections fell for the first time since the epidemic began in 25 years before. And according to the most recent estimates, about 33.3 million people are living with HIV today. Okay, HIV/AIDS incidence. The CDC estimate approximately 50,000 people in the United States are newly infected with HIV each year. In 2010, there were an estimate 47,500 new HIV infections. Nearly two-thirds of these new infections occurred in gay and bisexual men. Black African American men and women was high on the chart, and then blacks had an HIV incident rate that was almost 8 times as high as the incident rates among whites. Um, the estimated new infected in the United States in 2010, this chart shows that white Men having sex with men, 11,200. Black men having sex with men, 10,600. Hispanic and Latino men having sex with men, 6,700. Black heterosexual women, 5,300. Black heterosexual men, 2,700. White heterosexual women, 1,300. Hispanics, Latinos, heterosexual women was 1,200, and black men using injecting drugs was 1,100. Okay. HIV/AIDS population and statistics. 1 in 5 people are aware that they have are infected with HIV and AIDS. Men who have sex with men account for 61% of all new infections in the United States in 2009. Since 1981, 1.7 million people in the United States are estimated to have been infected with HIV. Over 619,000 HIV has already died since the epidemic began. Who's at risk for HIV and AIDS? Gay and bisexual men, people who inject drugs, people that perform oral sex, substance abuse users, pregnant women, children, infants, transgender people, and also men and women. At this time, Keena Jackson will come up and present her part of the presentation.
Hi, I'm Keena Jackson, and I will be presenting today on pathophysiology, signs and symptoms of HIV, clinical symptoms of AIDS, prognosis, and ethical concerns in situations. Pathophysiology. HIV is a virus that infects, injures, and destroys CD4 and T cells of the immune system. CD4 or T cells produce plasma cytotic cells which the body needs for a healthy immune response. Suppression of the immune system creates immunodeficiency. Immunodeficiency affects the body's ability to fight off infectious diseases, infections, parasites, and bacteria. When a patient's CD4 number decreases to less than 200 millimeters cubed per copy, the patient is considered to have AIDS. Signs and symptoms of HIV. The patient may present with flu-like symptoms worse than they've ever had before. The patient will present with fever, enlarged lymph nodes, night sweats, dry cough, and a sore throat. Also, the symptoms may last from a few days to several weeks. But the patient must understand that if they're tested for HIV early in initial presentation, that the virus may not have developed antibodies and may not test positive. But at that time, the patient is very virulent and may pass the disease on to others. Keep in mind also that signs and symptoms of HIV occur in other illnesses, so testing is needed and HIV must be ruled out. Clinical symptoms of AIDS, which is acquired immune deficiency syndrome. That's when the patient's CD4 and T cells numbers decrease to less than 200 millimeters cubed. The patient is classified as immunosuppressed. The patient will present with severe weight loss, anorexia, and a wasting syndrome. The patient is susceptible to cancers, infections, viral infections, fungal infections, as well as parasitic infections. A couple of common diseases or disorders disorders. One is Kaposi sarcoma. It's when the patient may present with generalized purple papules all over the body, as well as herpes infections. A lot of times the patient will have perianal and rectal infections and also severe candidal infections. Diagnoses, HIV diagnoses, these are new. Regardless of when the infection occurred or stage of the disease, in 2013, there was an estimated 47,000 people diagnosed with HIV in the United States alone. In that same year, an estimated 26,688 people were diagnosed with AIDS. Overall, an estimated over 1 million people in the United States were diagnosed with AIDS. Deaths. An estimated 14,000 people with AIDS diagnosis died in 2012, and approximately 658,507 people in the U.S. with AIDS diagnosis have died overall. The deaths of persons with AIDS diagnosis can be due from any cause. That is, the death may or may not be related to AIDS. We have two pie graphs here. To the right, we have statistics for women in 2006. To the left, men. Initially, in the early part of the presentation, Lamika brought out that AIDS was once considered a disease of white Caucasian homosexual men. But as we see here, as of 2006, new AIDS diagnoses show that black women account for 66% of new AIDS cases. White women or Caucasian women, 17%. Latino or Mexican or Hispanic women, 16%. To the left, we have men. 43% of new AIDS cases are black men. 35 are white men, and in comparison, 20% is Latino, Hispanic, or Mexican men. Prognosis. As of today, 2015, there is no cure for AIDS or HIV, but there are treatments for symptoms. Most doctors or infectious disease physicians are hopeful that with the right treatment and care, that means that a person with HIV can live a normal life. Researchers calculated in the year of 2008 that modern HIV treatment would mean that people with HIV would live well into their 70s. There is a growing agreement that most people with HIV in the United States will not die from HIV virus. Ethical issues of HIV and AIDS. We as nurses and other healthcare professionals have to deal with ethical dilemmas on a daily basis. We can all agree with that. But the AIDS epidemic has generated an enormous controversy affecting how we care for our patients' rights. The AIDS situation highlights the precarious balance between the individual rights, the public welfare, patients' rights, and our rights and rights of nurses and professional obligations. Ethical questions have also raised concerns regarding equal rights to healthcare resources. Implications for nursing practice and education are outlined to help us to make ethical rather than decisions based on our emotions. I will now bring up Andrea Jackson. She'll continue.
My name is Andrea Jackson. I'm going to be presenting diagnosis, transmission, prevention, and insurance with AIDS. HIV is diagnosed via blood test and or oral fluid test. Testing. The only way to know if you're infected with HIV is to be tested for HIV. The CDC recommends testing everyone between ages of 13 and 64. The most common HIV test is the immunoassay, which tests for antibodies in the blood. The rapid test results in 30 minutes. It uses blood they test with blood and or oral fluids for that test. There are home HIV tests that can be over the counter at drugstores. One will be a finger stick test. The other is an oral swab test. RNA tests detect the virus directly instead of antibodies. This HIV diagnosis. If a patient tests positive for HIV, they will have to have follow-up testing, which is there will be additional testing to prove that they do have HIV. This includes an antibody differentiation test, a H1 nucleic acid test, and a Western blot. HIV transmission. HIV is transmitted by fluids coming into contact with either mucous membranes, damaged tissue, or directly injected into the bloodstream. These fluids include blood, semen, seminal fluid, rectal, vaginal, and breast milk from HIV infected patients. In the U.S., HIV is primarily spread by intercourse or sharing injection needles with someone with HIV. As far as prevention in HIV, it is very important to use condoms consistently and correctly, choose less risky sexual behaviors, reduce the number of people you have intercourse with, and never share needles, and then there's always abstinence. But clinically managing HIV can be very intensive because there is no cure, of course, for HIV. It includes medication, tests, home health services, and support groups. The impact of HIV and AIDS on the family, it can include guilt, stress, anger, grief, loss, frustration, and depression. As far as the individual, due to the fact that there is no cure and this is a lifelong disease, they have a loss of self-identity, social isolation, impaired thinking, and decreased capability to care for themselves. The cost of treating someone with HIV, of course, can be very expensive. HIV screening is covered by health insurances without a copay due to the Affordable Care Act. If you do not have medical insurance, there are places that you can go for treatment and or testing at a reduced cost. If your insurance company, if you have insurance, they may pay for treatment. If you do not have insurance or your insurance company will not pay for treatment, there's government programs available such as Medicaid, Medicare, the Ryan White Care Act, and then community health centers may also be able to help aid in cost of HIV. The U.S. federal funding for AIDS is on a global level at 25% of $23.3 billion. 50% of the care and treatment is 50% of the cost goes to care and treatment, and then unfortunately only a 4% in prevention as far as in prevention care. 12% goes to research, housing, and cash at 10%. There are free HIV testing sites in this area, which include this hospital here, Methodist South Hospital, Memphis Health Department, and Friends for Life. As far as insurance companies that will aid in prevention and or care of HIV patients, is Medicare, Medicaid, and then of course checking with your private insurance companies for eligibility. I'll now introduce to you Sylvia Silas. She's going to be giving the last part of the production.
Again, I'm Sylvia Sias, and I'll be talking about the top 10 problems associated with HIV. Here we have listed the top 10 problems that are associated with HIV, and I'll go through the first 5. Alright, the first one is knowledge deficit. Interventions as a nurse, we would want to instruct our the patient, family, and friends about the routes of transmission of HIV and how to prevent the transmission of HIV. We would want to discourage them engaging in any risky behaviors that might put one at risk. Expected outcomes for knowledge deficit would be that the patient, family, and friends state the means of transmission, how to reduce risk of exposure, and to demonstrate knowledge of safer sexual practices, and also to avoid an IV injection drug use and sharing of drug equipment with others. Next, we would talk about risk for infection. As a nurse, we would monitor for signs and symptoms of the infection. We would teach our patient and caregiver about the need to report possible infection. We would monitor their white blood count and the differential. We would obtain cultures as prescribed, and we would instruct the patient in ways to prevent infection overall. Expected outcomes would be to identify reportable signs and symptoms of infection, have them maintain a healthy weight, report any adequate energy level without excessive fatigue. We would also want them to take appropriate therapy as prescribed and modify their activity to reduce risk of exposure to infection and infectious persons. Next, maintaining adequate nutritional status. We would assess for signs of malnutrition and obtain their dietary history, assess for factors that interfere with oral intake and reduce those factors, and also instruct the patient on ways to supplement their nutrition. Expected outcomes would be an increased appetite that would state the understanding of nutritional needs and identify ways to reduce factors that limit their oral intake. We would encourage them to rest before meals, and we would want them to report increased dietary intake. With maintaining skin integrity, we want to assess their skin and oral mucosa routinely for changes in appearance, encourage the patient to maintain balance between rest and mobility whenever possible, and apply any medicated lotions or ointments or dressings to affected skin areas as prescribed. The goal is to have maintained skin integrity and structural intactness and normal function of skin and mucous membranes. Next, there is a big risk for social isolation related to HIV. As a nurse, we want to assess patients' usual patterns of social interaction, observe behaviors indicative of social isolation, provide instruction concerning modes of transmission, and allow time to be with our patients other than giving medications and doing procedures. And we want to encourage participation in other diversional activities. Expected outcomes are that they share with others their need for this valued social interaction and demonstrate interest in events and activities and communication. We want our patients to verbalize feelings and reactions to diagnosis, prognosis, and life changes, and identify those modes of transmission of HIV, and to also identify their resources and use them appropriately. Living with HIV and AIDS. The truth is that many people live for decades with HIV and AIDS and have a normal and near normal lifespan. Patients can help prevent HIV from progressing to AIDS by seeing their doctor regularly and following their doctor's guidance. There's an importance for safe sex. Using a condom and other latex barriers can help protect patients from other STDs as well as other strains of HIV, which may be resistant to anti-HIV medication. Even if a person is being treated and feels well, they can still infect others. Avoiding other HIV-related infections is important also. Due to the weakened immune system, people with HIV can be vulnerable to infections like pneumocytosis, pneumonia, tuberculosis, cytomegalovirus, and toxoplasmosis. The best way to reduce the risk of being compliant with these medications. With some infections can be prevented with using drugs. With having children, infected mothers can indeed pass the HIV virus to their babies during pregnancy or delivery, but pregnant women with HIV can take medications to treat their infections to help protect their babies against the virus during delivery. Support groups and counseling is also a big thing. During counseling, a qualified counselor helps the patient cope with or change their thoughts, feelings, and behaviors regarding HIV. Patient and family caregivers may also benefit from counseling. Counseling can be short-term or long-term. Sessions may be individualized or part of a group, or the choice of the counseling is based on your individual needs, backgrounds, and symptoms. Counseling sometimes includes becoming a member of support groups. And support groups are often good places to share information, problem-solving tips, and emotions related to HIV. You can have different forms of therapy. One is interpersonal therapy, which focuses on current relationships. Cognitive behavioral therapy identifies irrational or faulty thinking and helps to change problem behaviors. And psychodynamic therapy focuses on unresolved childhood and teenage experiences and their impact on your current thoughts and feelings. Why is it done? People who are infected with HIV have a great risk for developing depression, and counseling helps you deal with these emotional aspects of the disease. Grief counseling can also help you deal with the end-of-life issues if needed. In conclusion, HIV and AIDS remains a persistent problem for the United States and countries around the world. While great progress has been made in preventing and treating HIV, there is still much to do. And this concludes our presentation. At this time, we'll take questions.
Do anybody have any questions? All right, Jackie. I can't hear you. Okay. Discharge, on discharge, most of what we do here at South in non-acute, we do free HIV testing. And when we do the free HIV testing, the patient can come in through the emergency room and they'll send them to non-acute area. And once it takes about 20 minutes for us to do the HIV testing, and we do that from like swabbing the inside of the mouth, swab the inside of the mouth. The patient wait at least 20 minutes, and if the patient test is negative, then we give them those results. But if the patient test is positive, then we bring in a HIV advocate in when the HIV test is positive. Then that HIV advocate can go over that, talk to that patient about the process of taking their HIV medication, and also they can let them know that they're not alone. And also that HIV advocate, that person has HIV themselves, so that patient will have some support, and they will have somebody to let them know the process of how to take the medication, exactly how they will feel, and that HIV is not a death sentence. And they can live a normal life with that disease. Do anybody else have any more questions?
Yes, where can we send our patients, for testing HIV?
It's non-acute area. That's in the part of
we care for the health of the body, mind,
the
and
ER.
spirit.
So
that's
it's
all
assigned,
daily
it'll let
moment
you
of
know
prayer.
where to go to get
Almighty
those
God,
tests done.
We know you as the great physician who heals,
Also, can they,
restores,
get clean
and
meals and
renew our
condoms?
mind, body,
Where
and
can they
soul.
get
Yes, they
clean?
also can get, they can also
Healing
get
and
some
wealth.
information on
It is our
HIV, some
prayer
clinics
that
where
you
to go
equip us to be
to,
blessed
and
with
also
those
they
we
can get
serve,
some condoms.
those
We
we
have
pray
a
for, and those
HIV,
we give support.
advocate,
We ask that you bless
here
our
in South. Her
patients,
name is
families,
Miss Teresa
and
Williams.
friends who spend
And
time expressing
once
their love.
we get that
Now, Lord,
information
about
from the
everything that we
patient,
do,
their
we give you
information,
glory.
we can call
In your
Miss
name I
Teresa
pray.
and she can get
Amen.
all those things to their patient.
Thank you.
Okay. Do anybody have any more questions? Okay, well, that concludes our presentation, and I thank you all for coming.
Thank you.
Thank you.
All right. I know y'all are busy. Thanks for taking the time.